Hello there, I'm Dr. Brian McKay from Core Health Darien, and my podcast is Not Just a Chiropractor for Stanford, Darien, Norwalk, and New Canaan. I want to go over some a therapy that we're using with quite a lot of success these days for knee pain. And the therapy is called officially horizontal therapy, and it has something to do with how it's a form of electrotherapy. But it's not like a TENS unit. It's not muscle stim. It's a lot more effective. I want to go over the mechanisms on how this is such an effective way to treat knee pain. All right, as we have an incredible knee program going on right now. It's based on a couple of different things. We call it the Neon Trac solution. But the interesting part is it's just a phenomenal result that we're getting, and it's the stuff that goes on the cellular level within the knee joint. Most people you're familiar with how knees wear away or the meniscus wears away. Well, the Neon Track solution has some really incredible stuff going on because one, I want you to think about milking a joint where there's a gentle certain number of pounds of pressure put on the knee and it's gently tractioned. What that does is it allows for disbursement of the synovial fluid. Now, synovial fluid is produced within the joint, and that's like lubricant. You can't run your car without oil. Well, you certainly can't run your knee without synovial fluid. And that's what happens. So the meniscus starts to wear away when it's not properly lubricated. So the Neon Track solution, one part of it is with this traction unit will actually gently traction the knee, pumping it, allowing and stimulating the cartilage to produce more synovial fluid. But what I want to go over is some of the heavy, hardcore stuff that goes on with for the powers that be want to call it horizontal therapy. It was developed by a German physician, and it's something that's not really common over here. Quite honestly, because the machine is so darn expensive. I mean, you can go out and get a cortisone shot, and it won't cost you. Your insurance might cover it, but this is a pretty expensive machine, but it delivers results, especially when used in conjunction with the Neon Track machine. So what happens is with one of the benefits is there's a reduction in the pain in the tissue thanks to dispersion and reduced concentration of local pain and inflammation transmitters resulting from the biomechanical action of the shaking effect. Now, what happens is you have many different frequencies. So the horizontal therapy comes up at 4,000 cycles per second. So you got to think of all those cells, all those cells getting stimulated at 4,000 cycles per second. It's an awful lot, but it's stimulatory. Okay, so in a sense, you would call it muscle stimulating, but we're not. What we're trying to do is we're actually stimulating on the cellular level. So the other effect this has is it stimulates the receptors in the cell membrane. And it does that by stimulating production of adenylate cyclase, which is one of the main intracellular mediators called cyclic AMP. AMP is a powerhouse in the cell. All right, now the other thing what makes it special is there's a bioelectrical effect with the shaking that's done on a cellular level. You're not going to, it's not like you're going to see your leg shaking, but inside the cells is shaking at this 4,000 cycles per second. And so what it does is the bioelectrical effect then creates biomechanical stuff. And so it allows for better communication from a cell to cell, channel. So the intracellular synapses that enables the cell to communicate is enhanced. All right, so that's kind of pretty high level stuff. And then what happens is the flow of information between the cells is activated, and this then promotes intracellular metabolic production of the cyclic AMP, the cyclic adenosine. So what happens over a period of time is it also then activates enzymes in the cell. And so again, we have further stimulation of the metabolic processes. So what you have going on here is incredible, an incredible, biochemical, biomechanical effect on knee pain. And, you know, so they're actually improving cellular metabolism and the efficiency of the enzymatic processes within the cell. And this is really, really important because we can help stimulate production of the synovial fluid in this form. And it's just one of those things that you really can't feel. What I would say is, if you were interested, give me a call, 203 656 3636. 203 656 3636. What we'll do is take a sample session. I mean, this thing really, really works, and let's make it work for you. But I'm going to explain a couple more things. So let's take into consideration a geriatric patient with a bad knee. What typically happens is that the pain in the knee starts to restrict the movement. And this particular therapy works on the cellular metabolism to increase the efficiency of the enzymatic processes within the cell. And this happens by precise positioning of the molecules in an alternating electrical field. So what happens when you have this high rate of 4,000 cycles per second, it increases the probability that the molecule and the enzymes meet in the correct position with the correct orientation. So it's just, there's so many cycles per second that you have a better shot at achieving what we want, which is these two things meeting with and what happens then is when they're in the correct position and the correct orientation, the reaction is going to take place in the chondrocytes, and that's where cells in the cartilage, play a reconstructive role. And what it does is decrease the inflammation and the degenerative processes. So I think that makes somewhat sense, and hopefully it's not overcomplicating it. Now, you're probably wondering how this affects pain. And the frequency stimulates analgesic activity. And it does so in working on the nociceptive receptors of the tissue, which blocks the conduction of nociceptive stimuli. So what happens as a result is, we're talking about pain reduction. Nociceptors are nerve cells that transmit a certain response back to the brain, letting them know the situation is there. And again, all pain, while it's localized in your body, is really comes to the brain. So we're eliminating the painful peripheral reactions coming from the muscle fibers. Okay, nociceptors go from muscle to the brain, and these are the fibers that are affected when you have arthritis. So this makes it easier for the patient to move around. They have less pain in the joint, and they're able to move better, which then allows for circulation of synovial fluid. So it stimulates a mechanical effect. You take the person out of pain with the knee, and this is not a drug, by the way, which is really wonderful, because the drugs, do they work? Cortisone, how many shots can you get in the knee? I mean, if you're a professional football player, that's one thing. If it really is, this is for someone, think of the geriatric patient with a bad knee. They get less active. The muscles atrophy on one side. The pain gets to be so bad so they don't move. So you have like a downward cycle instead of upward cycle, and that's what, by reducing the pain, using the horizontal therapy, it really makes a big, big difference in the quality of the person's life. So the tissues are also less congested after horizontal therapy. So what I'm trying to say here is, horizontal therapy is an effective modality for knee pain. Now, there are some offices, I'm not the only office in town that offers it. In Connecticut, there's very few who actually would make the investment. But the Neon Trac solution for your knee pain is a viable way for you to stay out of pain with your knee and get back to the quality of life, okay? That's what we really want. We want you to get active and stay that way. I'm Dr. Brian McKay. Core Health is located at 551 Post Road in Darien. You have a question, give me a call, 203-656-3636. 203-656-3636. Thank you very much.